It has claimed 1,145 lives. It continues to spread at a rate that the World Health Organization says is alarming and notes that the Ebola outbreak in West Africa was vastly underestimated. And 3 days after the World Health Organization classified Kenya as a high-risk country of transmission, the government has suspended entry from and through some of the affected countries, namely Sierra Leone, Guinea and Liberia, effective on Tuesday 19th, midnight.
And just to add to that, those three countries constitute about 99% of all the cases for Ebola. This suspension applies to all Kenyan ports of entry. The suspension will exclude health professionals supporting efforts to contain the outbreak and Kenyan citizens returning home from those three countries. However, such passengers will have to undergo extensive screening and therefore close monitoring and where necessary shall be quarantined.
The announcement comes as Kenya Airways suspends flights to two of the affected countries, namely Sierra Leone and Liberia, from Tuesday.
To our esteemed guests who are booked on the suspended flights, we wish to express our sincere regret for disrupting your travel plans. We further wish to confirm that we shall be providing for full refund of all tickets earlier booked and paid for prior to this suspension.
These measures coming at a time when there have been serious concerns about just how the government is managing the porous borders and how effective is it to ban flights and not other forms of transport.
Our ports of entry will also be manned to make sure that if you say you fly to a neighboring country and drive here, you'll be caught by the border point. So it's very inclusive. It actually has managed to capture everybody who comes to this country from those countries. I did say in my statement that we exclude Kenyans because Kenyans have got the right to get back to their country, whether they are infected by Ebola or not.
Kenya has already had its fair share of an Ebola scare. In the last 48 hours, the Ministry of Health had received 5 alerts of suspicious Ebola cases from various hospitals and the airport. All of the suspected patients had come from countries that are grappling with containing the virus.
After clinical assessment, laboratory samples were taken from the 4 suspected cases to our KEMRI, where we have diagnosis of capacity to diagnose Ebola. And I'm glad to report that all the 4 samples tested negative for Ebola. So that is pretty good news for us. So for me, I just want to reaffirm again, we don't have Ebola, and all the 4 suspected cases are negative. One did not really meet our criteria. So this patient did not have fever, and we thought then it does not really fit in, has not traveled outside the country, didn't really fit our case definition.
While the government asserts that it is in control, some of the countries in West Africa are having a tough go at a disease that kills 90% of its patients, with beds filling up faster than they can be provided. According to WHO, this is evidence enough that the outbreak in West Africa is far more severe than the numbers show. How the rest of Africa chooses to prevent an importation of the deadly virus, given the social and economic implications, will tell whether the continent can indeed handle a major health scare. For Citizen Weekend, I am Anne Mawathe.